provide that. How would you define palliative care, and why do you think it's important? What are the benefits of having palliative care versus not having it, in your opinion?
So I'll take this one. So I think that palliative care is a subspecialty of medicine which focuses on pain and symptom management in the person, determining what their goals of care are so that they can align their treatments with their goals, and all along providing support for both the patient and their family. And it's really a specialty that should be available to anyone, young or old, at any time of an illness, that they don't have to be either elderly or with cancer or actively dying. Yet it seems that because physicians are poorly trained in having these discussions and poorly trained really in prognosticating illness, that we are unfortunately making late palliative care referrals that then overlap with hospice. So that's why people only think of palliative care equating with hospice and being a very short life expectancy, because the average length of stay, at least in Connecticut, currently in hospice is 14 days. So if you think palliative care is hospice and hospice is 14 days, it's actively dying patients. But that's not really what it is. So it's so important to have opportunities like this to talk about what palliative care is, what hospice is, what the similarities and differences are, so that we can educate not only the general public, but frankly, clinicians, because there's a lot of mystery and misunderstandings and myths about what these palliative care doctors do.
Very true.
No, well, the one time Donna's heard the story, but the one time that I realized that there was a major problem in communication within the healthcare system that David had his transplant at was when he was in strict isolation following his stem cell transplant. And David was a very easygoing, happy-go-lucky young man. And the only one I ever heard him yell at was his sister. That was the only person he got angry with. But when he was, a week after he was in strict isolation, I saw a major personality change in him. And he started becoming very belligerent, confrontational, and he was swearing, and he was just crying and angry. And I kept saying to the doctors, why is he acting like this? This is not part of who he is. And he said, oh, we see this a lot in children who have transplants. When they're in strict isolation, this is how they respond. And it just didn't feel right to me at all. My gut feeling was telling me that he had a fear about his own mortality. So I asked if they could call in a psychiatrist, and there was only one child psychiatrist at this facility. And the doctor came in and basically asked David, what's your relationship with your mother? And that didn't help anything.
Yeah.
And so after the doctor left, I said to David, how was the talk? Did he help you? He says it was baloney. And he says he just talked about you and our relationship. And the next day, the doctor came in to do another follow-up session, and David fired him. And my 15-year-old son fired the psychiatrist. And so that's when I realized, who's going to talk to David? I couldn't do it. I just couldn't do it. And so finally, his favorite transplant doctor came in, and I asked him to do it, and I could see he was very reluctant to have this conversation. But then I finally said, I'm not going to ask you, I'm going to demand you to do this, because David has to talk to someone. And that's when the doctor walked in very reluctantly. And I mean, you could really see he was very apprehensive, and he didn't come out for 3 hours. And so he finally came out, and he looked totally exhausted. And he said, your son had a lot of philosophical questions. And he walked away. He was just so exhausted. It looked like he needed to take a nap.
Mm-hmm.
So Joe and I looked at each other and thought, oh my goodness, how is David going to respond to this conversation?
Mm-hmm.
And we walked into their room and
Mm-hmm.
he was smiling. And he was like, it was as though this burden had been lifted from his shoulders. And that's when I realized that every healthcare professional has to have not only to listen to the patient, but also to take the lead of what the parents feel is necessary.
Mm-hmm.